Hi, our group is doing a presentation on antihistamine. I'm Cheyenne Wilson.
I'm Ayan Hassan.
I'm Gina Barclay.
I'm Mary Mungai.
And I am Lorena Ramirez.
There are two classifications of antihistamines. There's first generation and there is second generation. We're going to be covering second generation antihistamines today. Antihistamines block the release or the action of histamine, a chemical that's released during inflammation that increases secretion and narrows the airway. Mold spores can be an allergen, also just spores from blowing, like when the wind gets really heavy, from plants and whatnot, pollen. So a lot of times that's what causes the seasonal allergies, and that is specifically what Zyrtec, which is the drug we're going to be covering today, is used for. It's used for seasonal allergies. Its generic name is cetirizine. It's a second generation non-sedating antihistamine, which means you can get rid of your allergies without needing a nap.
Physical anatomy related to antihistamine. The central nervous system affects the headache, drowsiness. The GI affects the nausea, constipation. The GU affects the diarrhea, which is difficulty urinating. In the mucocutaneous tissue causes itching, dry mouth, dry eyes, running nose, itchy throat, and skin rashes also causes. And the picture also explains the location of the mouth, the throat, lung, the GU. It doesn't have the GI, but it's next to like above the GU. The mouth causes the itching, tingling, swelling of the lips, and the throat causes the difficulty swallowing, coughing. The lung causes shortness of breath, wheezing, cough, chest pain, tightness. The GU causes abdominal pain, nausea, vomiting, and diarrhea.
Hi, now we're going to cover pathophysiology or how it is histamines and antihistamines work. Histamines are what contribute to the reactions that our body experiences, and an antihistamine is fundamentally blocking that entire process. So the primary action, as you can see in this diagram here, in the one diagram on the left says before the drug is taken, there's many receptors that are the lighter orange, and then the orange triangles represent the histamine. So once the histamine is released, they pair up with the receptors, and once they're in the receptors, they're active and they participate in the reaction from the allergy. So it can get pretty wild and out of control pretty quickly and be a pretty severe reaction. As compared to on the right side, the antihistamine is represented in blue, and it attaches, is shaped very similar, like a key in a lock, to those very same receptors that histamines attach themselves to. So their method of action is to attach themselves to those receptors, and by being attached to those, they don't activate the receptors, they block the histamine from actually making contact with them. So the more antihistamines that are in there blocking those receptors, the less significant the reaction. So it's a reduction in the active role of histamine. So that's how an antihistamine works, is it goes in there, it blocks those receptors, and the histamine response is greatly reduced. Next slide. This is kind of a broader view. As you can see, histamine is in the middle. The H1 through H4s, those represent the 4 different types of receptors found in our bodies. The next set of bubbles on the way out are a series of possible reactions from those receptors. As you can see, some of them include vasodilation, gastric acid secretion, smooth muscle constriction, mucus secretion, even tachycardia or arrhythmias. And then lastly, the orange bubbles represent the systems that eventually are affected by the smallest reaction of histamine. And that includes your skin, your cardiovascular system, your central nervous system, bone marrow, gastrointestinal. As you can see, it doesn't just affect your nose or your throat or itchy skin. It's a much broader, expanded view, and it really can impact your entire body, which is also why anaphylaxis reaction is so significant. Next screen, please. Next, we have common side effects, and this list includes two different things: general terms of allergy reactions, but it also has specific ones to our example drug of Zyrtec. So anything in bold is specific to Zyrtec, also known as citrazine. So sedation, even though it is a second generation one, is intended to be a non-sedating antihistamine, it can have sedation effects. So you do want to make sure you're not driving a car when you're taking it for the very first time, because everybody's different. It can react differently. Even though it's intended to not be something that causes drowsiness, it could. So depending on your chemical makeup in your body. So you just want to be careful of that. Other symptoms can be dry mouth, dizziness, fatigue, arrhythmias, which are, affecting your heart, dysuria, which is painful or difficult urination. There has been known, specific to Zyrtec, to have a very rare type of skin eruption reaction, which is fairly significant, but it's very, very rare. Zyrtec, aka citrazine, is used by a large number of people. The antihistamines do tend to dry things out in your system and can cause itching, mostly associated with that dryness. So a lot of itching, or of course, if you do have the rare skin reaction, you're going to be itchy anyways. So that is a list of common side effects with all allergies, but it's also, or with histamine releases, I should say. And then also, like I said, the bolded ones are specific to Zyrtec. And those are my slides. So next slide.
Nursing considerations. The first one is assess allergy symptoms, rhinitis and hives before and periodically through the therapy. The second is monitor blood pressure before and during therapy, since antihistamines cause arrhythmias. The third one is assess lung sounds and character of bronchial secretions. The fourth one, assess mental status, mood, and behavior when administering for anxiety, since they cause sedation. The fifth one, observe the character, location, and size of the affected area, the rash or the inflammation when administering for skin conditions. The last one is assess degree of nausea and frequency and amount of MSCs when administering for nausea and vomiting. Next.
Questions we have is, which of the following is not an effect of, not an effect, I can't see the whole question.
It's going to be on your side of the screen that you can't see it. You're going to have to move
Okay.
your pictures.
Which of the following is not an effect of the histamine produced in patients with an allergic reaction? A, arterial dilation caused by heat and redness. Contraction of local endothelial cells caused by local edema and swelling. C, decreased inflammation. D, nasal congestion and increased nasal secretion. The answer would be C, decreased inflammation. This is one of the therapeutic effects of antihistamine when given to a patient with allergies. Questions is, for one, is which of the following drugs is not considered an antihistamine? A, citrazine. B, simvastatin. D, diphenhydramine. D, fexofenadine. And E, digoxin. And question 2 is antihistamines cannot cause an arrhythmia. True or false? The answers will be D for the first one, digoxin, and for 2 would be a false.
This is just a picture of a drug card for Zyrtec so that you can understand how all of that information would go into one of our drug cards. And here's a list of references so that you can fact check if you'd like to see all of our information. Thank you for coming to our presentation today.